I'm Dr. Donald Zappone, and I'm the Executive Director of the Austin Child Guidance Center. We are a mental health outpatient clinic that serves children and families. We are located centrally at 45th and Lamar, and our mission is simply to improve the mental health of children and their families through early intervention, diagnosis, and treatment. And in this way, we give families and children the emotional skills they need to successfully navigate life. The message I would like to get out to the public is that mental illness is real, that it's not a passing phase, that it really happens to people. But the good news is it's treatable. I think anyone who's ever experienced a panic attack or has a phobia realizes it's not that easy. It's these waves that come over you for whatever, it might be biologically based, neurologically based. Surprisingly, young kids will start to express statements about wanting to kill themselves or feeling very bad about themselves. And this is something we take very seriously. We work with the parents to have a safety plan in place. In terms of the number of children that we see about 2,000 children and then another 1,000 family members. We have seen a rise in the past year in the number of calls that we receive for children and families that are seeking mental health services. We'll see kids as young as 2 or 3 years old up through 17 years of age. So we see a broad spectrum of kids, both in terms of their ages, and as well as race and ethnicity also at the Child Guidance Center. And we serve kids both on-site and as well as off-site. So we go into the schools and work closely with other community agencies. In young children, we're going to be looking for their ability to be able to relate to their peers, to socially get along. Are they developmentally where they need to be at that stage? If they are acting different than their peers, often that's how you begin to see some differences. One of the programs that we began several years ago was the Peer Assistance Leadership Program. And that program became so successful that actually we were able to transfer that to another agency that had a statewide impact. And as you know, teenagers are more likely going to talk to their peers. And so if you can have an older peer talk to a younger peer, that's a beginning step. And so we're real proud of the role that we played in exposing and developing that program here in Austin. For example, $25 would buy a therapeutic game for a child. It would pay for a cost of a group session for a child. It would cover the cost of 2 parenting classes that we have at the center. So that little bit really allows, especially those people who are living in poverty or low income, to be able to take advantage of our service. The I Live Here, I Give Here campaign is very important to us because so often mental illness particularly is not a front page item unless someone commits a very prominent suicide, but it's kind of a hidden illness. And for us to make that case to the Austin public and say, among your neighbors, your friends, the children that your children run around with, that they potentially have this need for affordable mental health services.